Hello everyone. Hello everyone and greetings from Dolphin Fiji Institute.
शुरू हो गया
I Prerna Bhavna welcome you all on this online session with Dr. Sudhanshu Kalra, Senior Pulmonologist, Dehradun, Uttarakhand, organized by Dolphin Student Welfare Council, Dehradun. Friends, Dolphin PG Institute of Biomedical and Natural Sciences is nestled in the beautiful Shivalik Himalayas of Devbhumi, Uttarakhand. We offer undergraduate and postgraduate courses in various disciplines with physiotherapy, medical microbiology, medical lab technology, biotechnology, forestry, agriculture, horticulture, biochemistry, chemistry, physics, botany, zoology, commerce, and we also have BA department. I now humbly invite Dr. Arun Kumar, Director, Dolphin PG Institute, for his inaugural address. Sir, please.
Thank you, Prerna. Prerna, can you hear me properly?
Yes, sir.
यस सर यस
You
सर
can hear me. Okay, that's fine. A very good afternoon, participants. I feel privileged in welcoming Dr. Sudhanshu Kalra, leading pulmonologist of Doon, and our distinguished guest speaker for the day. I also warmly welcome the participants in the webinar. Friends, as you all know, India recorded its first COVID case on January 30th, 2020. Since then, over 3.3 crore Indians have by now been infected with COVID-19, with more than 4.4 lakhs succumbing to the disease. Up to 3,74,269 people remain actively infected as of today. Thus, India has the world's second highest known caseload. While cases are now much lower in India, as we hear on TV, we read in the newspapers, the third wave is expected to arrive around October 2021. The current prediction is based on available data from the first two waves in various countries to prepare for the future surge in cases in India. We are fully aware that the last COVID 19 wave overwhelmed India's hospitals and was known to have killed more than 2 lakh people. The infectious Delta virus variant, first detected in India, was blamed by experts for fueling the surge. Unlike other countries, which are now seeing the ferociousness of the Delta variant, one positive thing that came out of deadly second wave is that a large segment developed immunity. So we do not expect cases to exceed about 70,000 a day unless a more infectious variant comes up during the potential third wave. The government of India is taking all necessary steps to ensure that we are prepared well to face the challenge and threat posed by the growing pandemic of COVID-19, the coronavirus. To stop a third wave of the pandemic, experts have said India needs to cover at least 60% of the population with both doses of vaccine by the year end. This requires a vaccination rate of 12 million doses per day. Mind you, I remind again, that we require 12 million doses per day if we wish to cover the 60% of the population by December 2021. Remarkably, India has delivered more than 75 crores of COVID vaccines doses since the launch of the nationwide drive in January this year. At this rate, up to 43% of the country's population will be covered by December. Of course, it's going to be much lower than the set target. The government had, however, announced a more ambitious target of 200 crore doses by December. As life resumes in India, with most cities lifting restrictions, authorities who were strongly criticized for complacency in the months and weeks before the deadly second wave are cautioning people to follow COVID-19 protocols such as wearing masks. We sometimes hear people saying that let us enjoy ourselves till the third wave, have parties, attend functions. That approach is not correct, my friends. That is inviting new infection. Love Agarwal, a senior health ministry official, said at a news conference earlier this week, we must remember that COVID appropriate behavior should be the new normal. That is the only way to win this war. I do hope our distinguished speaker will agree with me and young friends will apprise you with the nitty-gritty of the process in COVID control. Thank you very much. Thank you. And that is all I wanted to share with you.
Thank you, sir, for your inaugural address. And friends, today we are honored to have with us Dr. Sudhanshu Kalra, Senior Pulmonologist, Dehradun. Dr. Kalra did his MD in respiratory diseases in the year 1999. He has been a member and has fellowships of ICP, NCCP, API ERS, and ACCP. Dr. Kalra has served as a state coordinator IMA and TB project, secretary Doon Chest Society, senior advisor Indian Chest Society Uttarakhand chapter, and former president API Uttarakhand. Currently, Dr. Sudhanshu Kalra is director Yash Respiratory Disease Center. I now take the opportunity to invite Dr. Sudhanshu Kalra for his talk on coronavirus, possible threats of third COVID wave, and how to overcome from post-COVID effects. Participants' queries can be raised in the comment box. Over to you, sir.
Uh, Thank you, ma'am, for your kind words. Good afternoon, all participants. Thank you, Dr. Arun Kumar, for that welcome address. I believe Dr. Saab has already given a very elaborative account of what happened in COVID and how we progressed over the pandemic and where we are today. Friends, in Dehradun, we had a first case sometime in December or 2019 and early 2020. At that time, none of us had felt what was in store for us. I remember my first radio interview where I said, no, it would be like any other cough and cold. We should not worry, take care, all precautions. And then we had to eat our own words. Gradually, we realized what kind of devastation was awaiting us, how difficult it was to manage the scale of this pandemic. And we are all aware of what happened last year. However, once the first wave passed, we were all overconfident. We thought we have conquered this nasty virus. We dropped down our scales and things were improving. In fact, in last January, the economy picked up, lockdowns were down, and we started moving about, forgetting that the virus was there, sitting somewhere prowling upon us. We had not anticipated the second wave to the extent it came. At least the general public, no matter how much the health authorities and the government was crying hoarse that yes, second wave is there. The devastation of second wave was so great that till today we are facing the side effects, the medical side effects of all the complications that arose in those days. While we talk about the possibility of third wave coming or not coming at the later point in distance, I would briefly the complications this COVID gave, the complications that arose because of the COVID infection, and share with you how deadly this disease can be. So I would start my presentation. We are all aware of the common side. Just a minute, please. We're just sharing the screen and I'll come over to the slides straight away. Yeah. Am I audible? Are you able to see the screen now? Okay. When we are all aware of the normal symptoms that COVID had, the cough, the fever, the shortness of breath, diarrhea, chest pain, throat irritation. But the story didn't end there. What we see after 3 or 4 months of that acute phase of pandemic, that most of the elderlies with obesity, with comorbid symptoms, had very important post-COVID symptoms. And this post-COVID symptoms have been termed as long COVID. And it was found in patients who had at least more than 3 or 4 symptoms in the initial phase. They developed the long COVID. And the long COVID patients were those who were hospitalized, whose oxygen had fallen to critical levels. And we see these patients coming with symptoms persisting beyond weeks and months. It is 4 months since April when this pandemic was at its peak. And we still find patients coming with various kinds of symptoms. So this is what a long COVID is. Fatigue happens to be the most common symptom even after 5 weeks. Patients come to me today with, Dr. साहब बहुत थकान सी लगती है, काम करने का मन नहीं करता. So what is the most common post-COVID symptom is a fatigue. We found that it was about 12% of the patients that we saw. Cough is another very irritating symptom that patients are presenting even today. Patients come with headache, myalgia, loss of taste, loss of smell. Remember, loss of smell was one of the very important symptoms in diagnosis of COVID. It was almost equivalent to getting an RT-PCR done. This loss of smell usually comes back about 15 days or 18 days post-COVID infection. However, in some patients, it's still persisting even after 3 to 4 months of symptoms. Similarly, is loss of taste, sore throat, shortness of breath, low-grade fever, 99 degree Fahrenheit, patients coming with low-grade fever, nothing else, just temperature on the thermometer showing 99 degrees Fahrenheit. Nausea, vomiting. Some patients complain of diarrhea even at this late stage. Abdominal cramps. These are some of the long COVID symptoms that we are encountering even today. We see in this slide, nothing from top to toe, from head to toe, is left untouched. We had patients who had psychological problems, they had acute depression, they had anxiety, panic attacks, cognitive impairments was there. Patient felt एक fuzzy सा brain हो रहा है, brain fog लग रहा है, कुछ समझ में नहीं आ रहा है, concentration नहीं बन पा रहा है, सिर में दर्द, sleep disturbances. Patients were unable to sleep at the normal times. There was peripheral neuropathy, abnormal sensations all over their body, dizziness, Delirium was even found in elderly population. We had tinnitus, that is vague sounds coming out of the ear, earaches, sore throat, loss of taste and smell we have just talked of. We had skin rashes, fatigue, fever, and pain we have talked. Abdominal pain, nausea, diarrhea, anorexia, they all persisted for a very long time. Joint pain and muscle pain was another very important symptom that we encounter in these patients. Heart symptoms were, cardiovascular symptoms were equally important. What we saw was these patients had a lot of palpitations. Patients were fine. They finished their 14 days of quarantine, started coming out. And all of a sudden, they had a vague heartbeat going up to 130, 140, and then suddenly coming down. So this palpitation was very important we encountered in both. COVID had all was because of the inflammatory processes that occurred in our body because of the COVID infection. And most important, the respiratory system was infected or affected. Cough, shortness of breath, very common symptoms. Once in a second. And that was a time which was very, very difficult time for a physician, patient, and attendants to encounter. In there was oxygen shortages. There were no hospitals available. Those were difficult times. Hospitalized, oxygen bills, symptoms today. They are still feeling breathless. Their oxygen is still not fully. The AT score those symptoms which really bother us today, these with post-COVID fibrosis. If I explain it to you in a little more non-medical terms, we have एक तरफ अंगूर है और दूसरा है, तो मुनक्का है उस तरह से हमारा फेफड़ा हो गया है, तो उसके cells हैं, they are not able to carry oxygen. The main work of lungs is to produce oxygen. But unfortunately, once the fibrosis set in, जिसे हम सिकुड़न कहते हैं, then the patients are not able to produce enough oxygen. And that is the time when the oxygen on demand is usually not available. Patient might be well when he's sitting in a chair, lying down, but the moment he walks till his bathroom, he walks till his washroom, wears his clothes, changes his clothes, that's a time when the oxygen demand of the body rises and he's unable to really meet those oxygen demands. So you see how serious a COVID infection can be. It's not just those 14 days of quarantine. Many times it becomes a lifetime of difficult situation. Now, what is important is once you've had COVID, there are certain things that we really need to work. We have that must ensure that he's having at least a smoker or an alcoholic. We have to ask him to quit smoking and alcohol. What we found was that these difficult COVID symptoms were seen in those patients who were smokers, who were alcoholic, who were diabetics, and who had comorbid conditions. Normal population, normal healthy population got infected and they came in and came out without any symptoms. So it was this difficult category of smokers and alcoholics and diabetics who encountered the most difficult situation of their lives. We have to limit the caffeine intake. Important to rest and relax as far as possible, develop hobby building so that you can come out of those thoughts, those morbid thoughts of depression and panic. Gradually increase your exercise. After your immediate COVID infection, you don't have to start running 5 kilometers immediately. Self-pacing is very important. Increase gradually. Internet was full of what to eat and what not to eat. What was difficult was many of these patients, because of their loss of taste and loss of smell, didn't really like eating anything. But yet, it is important to tell these patients, to tell the attendants that if they will not eat, their body immunity will not be recharged. They have to really eat well to build their immunity again, which is important that we must eat protein-rich foods, get enough vitamins and minerals to help recovery process. Various kinds of beans, dals, fish, eggs, meat, paneer, anything that is on our table, which we call a nourishing diet, can be given pre and post-COVID, in pre and post-COVID patients. See a case where this is a fake name. This lady, she says that there were days that I did not even have energy to have bath. One day I decided to brave it out and shampoo my hair. I have long hair. After I had put the shampoo in my hair, I felt so tired that I could not even wash it. I almost blacked out. So I came out of the bathroom with shampoo in my hair and had to lie down for a few hours before I could wash it off. The fatigue was incapacitating. Now, these are the kind of histories that patients come and give us. As I said earlier, do not overexert. Start small household chores. Take frequent rest in between. Ensure that you're having plenty of fluids and proper healthy diet. These symptoms, we assure you, would gradually resolve in few weeks. No extra medicines are required if you are not into that category of pulmonary fibrosis. Family support and meditation would be of great help. Another patient said, I'm suffering panic attacks after recovering from COVID. Worst scenarios play out on my head and keep replaying. My heartbeat goes ballistic and there is no control over my body temperature. I am now struggling with this. I did not suffer this before COVID. Now, all these are live commentaries from patients who visited us post-COVID times. It is important that when the patient is feeling sad, stressed, confused, scared, we do not get angry with him. It is important to talk these people, build their trust. it is important for these patients to contact their friends and families as soon as possible. As I said earlier, alcohol and smoking and drugs need to be avoided as they have a negative impact on your emotions. If ever you feel overwhelmed, talk to your doctor, seek a counselor's help. Have a plan where to go, how to seek, and take proper physical and mental health needs as and when required. It is important that we develop skills that we had in the past once we had adversities in our life. We can bring out those skills to manage our present day adversity, manage our present day emotions. And that is how we'll be able to come out of these challenging times during this outbreak. It is extremely important not to worry, not to get agitated. It is extremely important that we stop watching televisions and the news channels which only spread negativity. What we find is that those negative effects really are carried on by these patients for a long time. The sights of those dead bodies, the lack of oxygen, long queues in front of hospital, those images are haunting these patients even today. So important is, let's not see negativity all side. If there were 100 deaths, there were about 10,000 people who went home also. So look into the positivity, look into what the medical profession did for you. Slight temperatures can be there. Muscle pains and joint pain, I just said, take paracetamol if possible, if the symptoms are not going. But yes, if the spikes are more than 100 degrees Fahrenheit and it's accompanying with shortness of breath, there is burning in urination, there is redness in the eyes, there's a severe pain in your belly, please consult your doctor. Not every fever post-COVID is going to be because of COVID. We are seeing dengue now. We can see any other normal fever post-dengue or post-COVID times also. So every post-COVID symptom of fever is not because of COVID. So consult your doctor if that mild 99 degree Fahrenheit is going beyond 100 degree Fahrenheit. So we have to think of dengue, we have to think of malaria, we have to think of other communicable infectious diseases that we usually encounter in our setups. Another very important aspect pre and post-COVID was the blood sugar control. Patients who were hospitalized had to be given steroids as a protocol from bringing them out after that crisis. So what the steroid did, it raised the blood sugar levels. So what we see is many non-diabetics had an elevated sugar levels even after their COVID infections had settled down. So what is important is regular monitoring of your blood sugar levels. Visit an endocrinologist or a physician and seek advice whether you need insulins, what kind of diet needs to be taken, how important would be exercise for your sugar control, keeping in mind the limitations that you have because of your compromised respiratory symptoms. So on one hand, we have to advise these patients to start exercising to control your sugar. On the other hand, we have to be cautious that yes, they'll not be able to exercise to the normal levels because of their compromised respiratory condition, because of the fibrosis or any other thing that is involved in their lungs. We must be very careful that high blood sugar levels predispose to all those fungal infections that we encountered immediately after that COVID pandemic episode. We have well passed beyond this now. For last 1 month, we haven't heard of any mucormycosis. But yes, that was again a very important disease that we encountered immediately after COVID, particularly in patients who had diabetes, and who were on high dose of steroids. These patients had headache, nasal obstruction, pain and loss of sensation in the face. Very important was any orbital or eye change. We picked up patients only on the eye swelling and redness. Patient complains of double vision, and we said, please go and get yourself admitted in a high institute. Maybe you're developing a fungal infection. But thank God, today mucormycosis is well under control, as COVID is, at least in this part of the country. Important do's and don'ts were that we should not self-medicate, especially steroids. Do not delay reporting symptoms of mucor. Early diagnosis and treatment can prevent the debilitating surgeries that mutilating surgeries that these patients had to undergo. Again, very important, give the diabetic history to your doctor and follow complete medical advice. Post-COVID levels, patients who are on home oxygen therapy or patients who are still encountering less oxygen, it's very important that they monitor their oxygen. They can do it 2 or 3 times a day. It is important that they use the same machine, same finger daily. Using different machines, different finger would give you different readings. So ensure that you're using the same machine and same finger daily, and you can do it for 1 or 2 times a day. Do not keep it in your pocket or on your table and keep checking it every 5 minutes. मेरी oxygen level क्या है? वो आपको panic में लाएगा, and that is not right. However, if your oxygen is persistently less than 90%, please consult your doctor immediately. It's important that all those patients who have developed pulmonary fibrosis, they seek medical advice, and besides that, start the medications that are meant for pulmonary fibrosis. But there is a very important aspect of exercising. The lung health can only be rebuilt by pranayam, by yoga. They are the very important cornerstones for the lung recovery. You can sit or stand while your elbows are slightly back, inhale, take deep breaths, hold your breath and exhale. Deep breathing exercises and incentive spirometry are doing really good to these patients. Have an oxygen concentrator or oxygen cylinder support at home if your SpO2s are falling below 91%. I repeat that pranayam and yoga exercises are almost a must for these patients who have developed pulmonary fibrosis, and not just for the lung health, even for your cardiovascular health, for your headaches, for your ENT symptoms. It's important that we follow the proper lifestyle and ensure that we do pranayams every day. Excessive steam inhalation is not required. See, what patients come, हम दिन में 4 बार भाप ले रहे हैं. What you are doing is, by taking so much of steam, you are actually killing or spoiling the normal infectious barrier that is there in your nasal mucosa. So do not play with the normal body mechanisms that help prevent bacteria and virus from going inside. Excessive steam inhalation would be one of those reasons why you will hamper the normal immune mechanisms that are present in the nasal mucosa. So avoid steam inhalation. A long, persistent cough is the most common symptom that these patients are coming with. It is important that we teach them a proper cough etiquette. give them antitussives, medications to control their cough, look into the symptoms, whether he's developed any pulmonary fibrosis. Many times what is happening in present times is that our thoughts are all focused on COVID. And we are forgetting that this patient could have developed tuberculosis also. This patient could have developed asthma also. He could be a case of COPD also. So we have to look the entire patient in totality and treat those coughs and the troublesome symptoms on the case basis, on the need basis. A dry irritating cough, besides the shortness of breath, definitely indicates that yes, the patient has developed a pulmonary fibrosis post-COVID. In this slide, we've shown the breathing exercises. We are all aware of it, how to do pranayams. And I will not waste more time on this. As I said earlier, it's important we do deep breathing exercises every day, regularly. Thank you very much. This is all I have to talk as far as the post-COVID care was concerned. But yes, there are issues about the third wave. There are issues of vaccination. There are issues of antibodies. I would be happy if I am able to answer your questions. Any questions, please? Please just message it to me. Any questions, please?
You can write in the comment box any queries if you have regarding COVID wave and the possible solution. You may write in the comment box.
Well, till we get the questions, I would like to talk about the third wave, if at all we will encounter that, and if we encounter it, how will we encounter it? See, when we talk of third wave, we have to be very cautious of the times we have recently spent. We will invite third wave only and only if we do not take the precautions, the universal precautions that are talked of day in and day out. We had second wave because at that time vaccinations had just started. The population that vaccinated was very less. Now the added advantage is that our country has more than 75 crores vaccinated people. Out of that, 20% are fully vaccinated, 60% are vaccinated with single dose. So even single dose confers a great amount of immunity. And as the day progresses, more and more population would be vaccinated. Now, coupled with this vaccination, if we put a mask, we are safe. However, only thing that stops us or which will force us towards a third wave is our inappropriate COVID behavior. What we see now today is most of the youngsters and even elderlies, you go on the roads, you see the traffic, you go to the malls, you see the kind of rush we have in the PVRs. All this is going to invite third wave, no matter how much we are vaccinated. So if we want to prevent the third wave, just remember those long lines for oxygens. Just remember a VIP call you made for a hospital admission. See the death and misery that your friends had. Remember that was very, very dangerous. And we can invite that if we do not have the proper etiquettes of COVID even today. Yes, we are all vaccinated. We will be vaccinated. Vaccination is a best thing that So we have to be very careful that the virus is very smart. It's mutating. Look at what Delta wave did to the country during the second wave. So we can have another Delta plus or a Delta lambda or any other variant tomorrow. So there the vaccinations would help you from going into the hospitals, into the ICU. But you can protect yourselves from minor symptoms even by wearing a mask. I know there is mask fatigue. We cannot wear a mask most of the time. I wear my mask for 8 hours a day, and the moment I go home, I have to throw it. But the moment you are in public place, ensure you're wearing a double mask even today. The other important would be the festival season that we are going to see tomorrow. We must ensure that we celebrate only with our close friends and families. Restrict your movement in those days. The large gatherings, the marriages, they were super spreaders during the second wave. It's still not right time to attend large functions. Smaller parties in AC rooms, another very important reasons for invitation to third wave. So we have to follow this for another 1 year, and hopefully by the Diwali of 2022, we'll be able to really go without this. But today, if we want to prevent the third wave, and let's hope and pray we do not see the times we saw in April, May, we do not see third wave, but we have to be very cautious. Another reason why third wave would be little difficult would be the body has developed immunity. Most of the patients or most of the persons have been infected. Even if they have been vaccinated, they have been infected by their close ones. So vaccine plus infection usually confer a very good kind of immunity. So your symptoms would be very mild, you'll not be hospitalized. Having said that, I still would like to re-emphasize that third wave can only be stopped by a proper adequate COVID behavior. Sir has asked a question, what is an advice to senior citizens while going to public places? Avoid going to public places as far as possible. Avoid unimportant travel. Tourism should be avoided as far as possible. Travel should only be for your business and for your important cause. So whether it is young or old, the advice is same. Still, please follow all COVID precautions. Another thing that usually patients come and ask me is, कौन सा vaccine लगवाएं? I would suggest, from 1 year back we didn't have choice. Today we are spoiled for choices. We have 3 or 4 vaccines which are there. They're all same. However, we have maximum amount of patients with Covishield, maximum experiences with Covishield. But whether it is Covishield, Covaxin, or the ones latest coming from JJ or any other company, they are all same. Their prevention levels or efficacy levels are all about 70 to 90%. It is not important which vaccine you take. It is important that you take the vaccine. That vaccine hesitancy has to go. 0.06 per million is the side effects of vaccine, any serious side effect. So normal body aches, pains, fever, they were usually encountered. But I would say, please, there should not be any vaccine hesitancy. And look at America and all the liberators there who said we will not put vaccine, it goes against our liberty. We not use mask, it goes against our liberty. For them, personal liberty is more than public health. And what they have done to their country again. America was more than 70% vaccinated. And yet, look at the waves they are having today. Only because of those liberators who talk of their personal liberties. Sir, getting COVID is not your choice. Once you are COVID positive, you are spreading it to your family, to your society, to your country. So getting vaccinated is a national duty and a responsibility. So please get yourself vaccinated if youngsters are listening and they are still hesitant and they still feel that masks are not important. Just look at what is happening to America.
So there is a question from audience.
Any more questions, please?
Sir, if CT scan is necessary to detect COVID patient?
A good question, sir. See, there were patients in early COVID times when these RT-PCR was negative. So in those patients who were having symptoms, but RT-PCR was negative, we advised CT scan to get the symptoms verified by a CT scan. And there, the CT score really mattered a lot. There were various kind of pneumonias, various changes shown in CTs, which were very specific of COVID. However, what we saw in those days, even those patients with mild symptoms, patients who had no symptoms, were standing in queues in the CT scans and getting infected. So get a CT scan done only when your doctor advises you. If RT-PCR is negative, mild symptoms, you do not need a CT scan. Get a chest X-ray done at the 7th or 8th day. That would be enough. CT scan only on doctor's advice. I got COVID. I didn't get a CT scan done. I did an X-ray on the 9th day. So, but yes, CT scan. So,
Sir, there is another question. How COVID harmful for children?
I'm sorry, I was not able to hear you. How is COVID harmful to children?
Yes, sir. Yes, sir.
See, what we have seen by past experience is that children have innate immunity. God has given that immunity. So even if these children were infected by COVID because of their parents used to go out, they brought COVID for their children, schools to band the. So they had mild to moderate symptoms. We had no fatalities and most of the children recovered well. So I would say that till now, the risk to children is almost same as adults. In fact, children, because of their innate immunity, have encountered COVID in a much better way.
Okay, thank you, sir. Sir, there is another question. Will the coronavirus become more dangerous in coming waves?
We cannot say this. We are not sure what kind of mutant emerges. Delta variant really caused havoc during the second wave. We had Delta Plus. Now we are talking of Delta 1.2 or more variants are coming. I would just want to say, do not worry about those symptoms. Do not worry about the severity of COVID. See what you can do. Corona will not affect you. Any variant will be, their effect would be mild if you are properly vaccinated and if you wear your mask properly. Two things, vaccine and mask, your armament against any variant. So do not worry about the severity of what comes in future. Hopefully, our country will be vaccinated and by God's will, we'll pass on in a very, we'll be very in a very comfortable position.
So, there is another question of an audience. What is the real role of immune system in coronavirus?
What is the
real role of immune system to coronavirus?
like any other disease, coronavirus is also affected by our immune system. He fights with the COVID. We see that in patients who had immunocompromised immunity, who were immunocompromised, patients who were diabetic,
Okay.
so all these patients who had cancer, on chemotherapy, diabetic, all these patients they were immunocompromised. Their body immunity was compromised, so they were more infected by the COVID. However, many times the body inflammation the inflammatory processes are also there, which we saw because of our body immunity, and that was when we had those difficult periods during the 14-day quarantine. But the role of immunity in curbing COVID is very important. There cannot be any more important armamentarium for us than a proper immunity of our body.
Vaccine is really helpful for upcoming pandemics, or there will be a new vaccine for.
मैडम, आपका क्वेश्चन नहीं समझ में आया मुझे, प्लीज आप रिपीट करिए, सुनाई नहीं दिया.
सर, क्या वैक्सीन है जो हमारी करे कि नई वैक्सीन आएगी उनके लिए जो
आप you are talking about vaccine, but I am not able to hear your question. What you mean to say is that there will be more vaccines coming. I'm not able to hear your full question, ma'am. जी जी जी.
जैसे नए आ रहे हैं तो उनके लिए वैक्सीन हेल्प है या वैक्सीन लॉन्च
जी जी. देखिए, ये देखा गया है कि जो हमारी आज की वैक्सीन्स हैं, चाहे वो कोविशील्ड है, कोवैक्सीन है, अमेरिका की फाइजर की जे है या उनकी मॉडर्ना थी, उन्होंने किसी ना किसी हद तक वेरिएंट्स के ऊपर भी काम किया. कल ये वेरिएंट्स आएंगे, उतनी तेजी से वैक्सीन्स को निकलना बहुत पॉसिबल नहीं है. यहाँ पे इसीलिए जरूरत है कि हम लोग मास्क लगाएं और जो वैक्सीन अवेलेबल है उसको प्रॉपर्ली यूज करते हुए अपनी बॉडी की इम्यूनिटी को बढ़ाएं. जो वेरिएंट्स आज के दिन में है उसमें 70 to 80% ये वैक्सीन्स ने काम किया है. और सबसे बड़ी बात यह है कि कोविड इज एन इवॉल्विंग डिजीज. हम जो आज एक चीज कहते हैं वो एक महीने बाद बिल्कुल बदल जाती है. सो इट्स अ साइंस विच इज चेंजिंग एवरी आवर. हमने कोविड के ट्रीटमेंट्स में देखा, अलग अलग दिन अलग अलग चीजें हमारे सामने आ रही थी, लेकिन एक ही चीज यूनिवर्सल है और एक ही चीज जो पहले थी और आज भी है, मास्क का प्रयोग करें, सेफ डिस्टेंस पे रहें. यस सर.
सर क्वेश्चन है, क्वेश्चन ले लूँ मैं?
हाँ लीजिए आप.
क्वेश्चन, हाँ सर, ये क्वेश्चन बच्चा पूछ रहा, बट इफ एनीवन मिस द सेकंड डोज ऑफ कोविशील्ड?
Doesn't matter. Whenever you have time, get your dose immediately.
Okay, there is no time to get.
Only thing is, yes, I am coming to it. Only thing is, if you are infected with corona, in case you had a RT-PCR positive, you were infected with corona, then you have to wait for 90 days. Other than that, if you have missed it for any other reason, please go and get yourself vaccinated. If you had COVID, then wait for 90 days and then get your vaccination after 90 days.
So I
Sir.
have a small question, sir.
Yes,
Now,
sir.
we are talking in terms of the booster dose, sir.
Yes.
So what is your opinion about it, sir? If at all it should be taken, if yes, then what should be the gap between the second dose and the booster dose? And sir,
Sir.
is it, yes, sir, we are calling it booster dose, sir, third dose, we can call it third
Yes.
dose. And has it to be the same vaccine for which we are taking first and second dose, or the booster dose could be a cocktail, it could be a cocktail.
Sir, what we were talking of booster dose today is nowhere in the national or international guidelines. It's only the companies that are talking as of now. One, the primary task of any government would be to vaccinate its entire population first. I cannot have the privilege of having a booster dose when my fellow citizen has not even got his first dose.
Yes.
So we have to understand that, sir. It is important to fully vaccinate 2 doses every other Indian before we think of a booster dose. So that would be the main motive of the government, and it should be, because if the rest of the citizens are vaccinated, we are also protected. So the talk of booster dose is still in the pipeline. However, once the entire country and the entire world is vaccinated, then we can think of booster dose. And at that point of time, we'll have to see at what level the pandemic is. Is it fallen down to epidemic levels? Has it come down to local levels even further? So COVID has to stay with us for long years.
I know.
All these questions of booster dose, we will only be able to address once the country is fully vaccinated, sir. Not at this stage.
Sir, what I wanted to ask was, is it going to be a solution? Is it something which is going to help us fight against COVID? Like some people take a booster dose every year for typhoid.
Sir, we
I was
do not
talking-
have enough. We do not have enough studies right now, sir. We do not know for how many months the antibodies would last in our body after the second dose.
Yes, sir.
So we don't have studies right now. Once we know the studies that these antibodies are going to last for 1 year, 6 months, 8 months, only then we can talk of booster dose.
This is what I
So,
wanted
and
to say.
yeah, this is another important thing. Please don't
Yeah, I
get
know.
your antibodies checked. What patients come to me, आपने एंटीबॉडी की बात करी, सो वहां पे एक चीज और इम्पोर्टेंट बताना चाहूंगा. मरीज आते हैं, हमारी एंटीबॉडी चेक कर दो वैक्सीन लगाने के बाद. उनकी 100 आती है, बहुत खुश हो जाते हैं, 15 आती है, नाराज हो जाते हैं, दुखी हो जाते हैं, हमारा तो कुछ हुआ नहीं. पर ऐसा नहीं है. Even if your body is not showing antibody, it's registered in your immune system. The memory cells of your body will help you whenever you are infected. So please do not get your antibodies checked. They are not standardized. So do not waste your money and time on antibodies. Get vaccinated. That is most important.
सर डॉक्टर साहब एक लास्ट क्वेश्चन और लूंगा आपसे. जनरल क्वेश्चन है, कोरोना वायरस होने के बाद म्यूकर माइकोसिस होने का खतरा कितने दिन तक रहता है? मतलब
अगर आप
ड्यूरेशन है?
जी, अगर आप डायबिटिक नहीं है और कोरोना वायरस इमीडिएटली 15 दिन के बाद आपको कोई ऐसा सिम्टम नहीं है, आप भूल जाइए, कुछ नहीं होगा. और अपना
Okay,
नॉर्मल
okay.
नेजल हाइजीन, कोई चिंता की बात नहीं. अगर आप डायबिटिक नहीं है तो मत सोचिए उस बारे में. हर कोरोना वायरस को म्यूकरमाइकोसिस नहीं हुआ, सिर्फ डायबिटिक्स को हुआ. ज्यादातर 99% डायबिटिक्स को हुआ. सो अगर आप डायबिटिक हैं तो चिंता की आवश्यकता है. अदरवाइज नॉर्मल कोविड takes its normal time and goes away like any other disease.
पूछना है डॉक्टर सर.
Am I audible, please?
Yes, sir. I can very well,
Yeah.
very clearly.
Yeah.
Yeah.
So any other queries we have?
नो मैम. ठीक है प्रेरणा मैडम.
Prerna, I think you can close.
Yes, sir. Okay, sir. Okay. Thank you, sir, for delivering such excellent talk on a topic which has utmost relevance in today's time. I'm sure this information will be very helpful for all the viewers. Now it is my privilege to propose a formal vote of thanks. We are thankful to Dr. Sudhanshu Kalra to spare his valuable time to honor our program for this online session today. Thanks are due to Director Sir Dr. Arun Kumar for joining us today for the inaugural address. Sincere thanks to the entire DSWC team and Dean Shri Vipul Garg for organizing such a wonderful program which is for the awareness of the students. Thanks to all the participants for joining us for the program. Last but not the least, thanks to the management and admin staff who cooperated in the success of this online program. Thanks to you all. Have a great day ahead.
Thank you, Dr.
Thank you,
very
ma'am.
much.
Thank you, Dr. Saab. Thank you, Mr. Vipul. Thank you very much.
Thank you,
I
sir.
really enjoyed this question answer session. I hope it was fruitful. Thank you very much.
It was, sir. It was very. We learned so many things today. Thank you, sir. Thank you very much.
Thank you.
Yes, sir. Thank you, sir. Thank you very much. Okay, sir.
Thank you. Thank you.